My name is Alexandra Lucas. I am a professor of cardiovascular medicine at the Biodesign Institute and Arizona State University, and also a professor of cardiology at Dignity Health. This is in Tempe and Phoenix, Arizona. I have been working with vascular disease for many years, and our current work is on the use of viral immune modulators in vascular disease as potential treatments, and also the effects of viruses themselves, both in protecting and exacerbating atherosclerosis. It's a fascinating field. We worked on it for about 25 years, starting in Canada and then working in Florida and now Arizona. We derive native viral immune modulators from a virus that only infects rabbits. And we've taken one of these all the way through to a clinical trial and proven that the protein, a serpin, SERP1, is safe and reduced markers of heart damage. And that was at 7 sites in Canada and the US, a randomized trial. We've now gone on to make peptides derived from the serpins. We've investigated multiple other proteins derived from viruses with various efficacy. We look at severe diffuse inflammatory vascular disease that's very hard to treat, Takayasu's and giant cell arteritis. And we have also looked at transplant vascular disease that's the leading cause of graft loss, transplant graft loss after the first year post-transplant. Recently, we've made peptides from these same serine protease inhibitors, one of which improves survival in mouse models. And we've made modified peptides that have increased activity. And the very, very recent work, which is not yet published, has shown us that by adding antibiotics to a virus infection that aggravates atherosclerosis, not only do we accelerate the inflammatory disease and increase mortality, so the antibiotics were not good, and losing the gut bacteria actually made the whole disease worse. But it also removed some of the efficacy of our proteins. On the good side, we've made a modified peptide that recovers the activity, and we now have activity again and improved survival in this virus-induced atherosclerosis in the presence of antibiotics. So overall, long story short, we're using viral proteins and viral peptides as immune modulators to reduce inflammation. They've improved survival and decreased markers of heart damage in animal models and also in one small randomized clinical trial. And we've now found that they also may interact with the gut microbiome.